Do you frequently feel like your heart pains sometimes? Or maybe your joints hurt, even when you haven't done any hard work? What if you get a strange rash after being in the sun, or feel extremely tired all the time, even after a full night's sleep? These could just seem like small issues, stress, maybe a virus or overwork. But what if they're connected? What if your body is actually attacking itself without you knowing? That's what happens in systemic lupus erythematosus, or SLE. It's a long-term illness where your immune system, the very thing meant to protect you, mistakenly harms your own body, like a security guard attacking the person he's supposed to protect. Imagine your immune system sending soldiers antibodies to fight an invisible enemy. But instead, they damage your skin, joints, kidneys, or even your heart. That's SLE, a confusing, quiet storm inside you, with different symptoms popping up at different times. So, what causes this mix-up in your body? Well, doctors don't know the single cause, but think of it like a broken alarm system. Your immune system's alarm goes off even when there's no danger. Why? Several things team up. First, genes. If someone in your family had lupus, you might be more at risk, like inheriting a slightly faulty alarm code. Then, hormones. That's why 9 out of 10 people with SLE are women, especially during childbearing years. Estrogen might be turning up the volume on the alarm. Then, environment. Imagine sunlight, yes, just sunlight flipping a switch in some people and triggering lupus. Viral infections, like cold sores or colds, might confuse the immune system too. Some medicines can also cause drug-induced lupus, but that usually goes away when the medicine stops. So it's not one thing, but a chain, genes plus hormones plus environment, like a recipe for a storm in your body. Now, what does SLE actually feel like? Think of it as a shapeshifter. It can look different in every person. Some feel joint pain, like their fingers are stiff and swollen every morning, just like arthritis, but it comes and goes. Others get a butterfly-shaped rash across their cheeks and nose after being in the sun. Ever worn a mask and then seen red marks? That kind of redness. Fatigue is another big one. Not just I didn't sleep well tired, but I slept 10 hours and still feel drained tired. Some people have fever, hair loss, or mouth sores. Others may feel chest pain when breathing deeply. That's the lining of the lungs or heart getting inflamed. In worse cases, lupus attacks kidneys. No pain, but pee might get foamy or swollen ankles appear. Because symptoms come and go, called flares, it's easy to ignore at first. One week you're fine, next week you can't get out of bed. That's why so many say, "Doc, I don't feel right, help me figure this out." How do doctors catch this sneaky illness? It's not one simple test. Instead, they play detective. They'll ask any rashes, joint pain, family history. Then run blood tests. One key test is ANA. A positive ANA means your body is making antibodies against itself, like finding fingerprints at a crime scene. But not everyone with a positive ANA has lupus. Some healthy people do too. So doctors check more tests for anti-dsDNA or anti-Smith antibodies, which are more specific. They might test urine for kidney damage or do a skin or kidney biopsy. It takes 4 or more clues from a list of 11 common signs to confirm SLE. Treatment can't cure it, but can control it. Think of it like managing a wild garden. You don't destroy it, you keep it under control. Common medicines include hydroxychloroquine, a pill that calms the immune system, steroids like prednisone, which reduces swelling, and stronger drugs if organs are involved. The goal: stop flares, protect organs, and help you live fully. You take medicine even when you feel fine, kind of like wearing a seatbelt, just in case. Can you stop lupus before it starts? Not exactly. Remember, it's a mix of genes and environment we can't fully control. But you can reduce flares and protect your body. Think of it like weatherproofing your house. Avoid too much sun. Wear hats, sunscreen, long sleeves. If sunlight triggers your rash, treat it like a storm alert. Quit smoking. It worsens lupus and reduces medicine benefits. Manage stress. Ever notice you feel worse during exams or big life events? Stress can act like a flare starter. Regular checkups are key. Even when you feel fine, get blood and urine tests to catch kidney issues early. Stay active gently, walking, swimming, to keep joints flexible. Eat healthy, like less salt if kidneys are involved. And never stop meds on your own. That's like turning off the alarm system mid-storm. Prevention isn't about avoiding lupus completely, but about living well and staying in control. Good news, science is moving. Researchers are digging deeper into why the immune system goes rogue. New medicines are being tested that target specific parts of the immune system, like fixing only the broken wire instead of replacing the whole engine. One drug, anifrolumab, was recently approved. It blocks a protein called type 1 interferon, which is overactive in lupus. Think of it like turning down a loudspeaker that's yelling false alarms. Scientists are also exploring biomarkers, clues in blood that predict flares before they happen. Imagine a warning light that says, "Flare in 2 weeks, take action now." Stem cell therapy is being studied too, to reset the immune system in severe cases. And here's a cool one. Some researchers are testing wearable tech to track symptoms daily, like a smartwatch that alerts you to changes in fatigue or heart rate linked to lupus. The goal, more personalized, precise care, not just treating everyone the same, but tuning treatment